the hospital. So in Colorado, using PRAM's data, they found that when babies breastfed within the first hour, didn't use a pacifier, roomed in with their moms, exclusively breastfed, and that the mothers had a way to get help after they were discharged. It's really key. Then we had, at 8 weeks, increased exclusive breastfeeding. Next slide. So what is the Baby Friendly Initiative? It is a World Health Organization and UNICEF initiative. And so therefore it's global. It's part of the global feeding strategy. And there are 10 steps to successful breastfeeding that are outlined by World Health Organization. In the United States, the Baby Friendly USA is the administrator of the project. And when a hospital implements those 10 steps, then they have external review and designation. Around the planet, we have more than 20,000 hospitals that are baby-friendly designated. And after I submitted this slide, there is one more. So now it's 127 in the United States, 47 in California, and 10 in LA County. So the numbers are increasing. This is about 18% in LA County, and we're right at the state average, 18% in California. Next slide. And research tells us you don't have to go all the way to baby-friendly to see positive outcomes. What this slide is telling us is that at 6 weeks, the risk of weaning is at 30% if no baby-friendly steps are initiated. Every baby-friendly step that is implemented within a hospital decreases the exclusive breastfeeding weaning. Is that cool? So if people do 6, the weaning rate at 6 weeks goes clear down to 3.2%. Very cool. Next slide. And the other really cool thing is that when hospital policies are implemented, when the baby-friendly hospital policies are implemented, then it impacts all race ethnicities. So I think of this as rising tide raises all ships. So our Caucasian women are breastfeeding at this particular rate, and our African American and US-born Latinas are breastfeeding down here. Baby-friendly happens in a hospital, and everybody raises. We haven't yet closed the gap. That's going to be you guys' job. But the cool thing is it impacts all of them. So you can't point at a particular race or ethnicity and say, oh, those ladies don't breastfeed. No, 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 they do when we support them. So that's really important bit of research. Another place, next slide, that it shows is these are California data from our newborn screening. And the ones that are circled here are the races that typically have the lowest rates. The California average is in the gray bars. And in baby-friendly hospitals in California, the breastfeeding rates, exclusive breastfeeding rates, are much higher in those race ethnicities compared to our state average. That to me is so exciting. When I said, I'm a data wonk. You know, I go, oh, good, look, it really is true. We all suspected that, but until this slide was published, we didn't know it for sure. So let's go on, the next slide. When a hospital makes a decision to embrace baby-friendly, or if they are in the pre-contemplative stage and just thinking about going down the path of maternity care improvements, quality improvement, they need to understand a few things, and that is that systems change is hard. Many hospitals have implemented quality improvement activities in many, many departments, but not so much within maternity care. And so the maternity care staff do need to learn how to implement quality improvement in their own facility. And this really comes from top-down management. When the administration says this is an area where we want to see improvement, then resources are allocated. Quality improvement activities are happening in hospitals all the time. We just need to, in maternity care, grab that knowledge and implement it, use it. And it's definitely a teamwork thing. Many, many hospitals that we've worked with that have told us as they go through the baby-friendly process, there's much, much greater teamwork and less finger-pointing. So the day nurses tend to go, oh, it's all the night nurses. And the night nurses go, no, no, it's the day nurses. And then both sets say, oh, it's the doctors. And then, oh, no, it's those people. And what's really, really cool in a hospital that's going through the baby-friendly process, and I've seen it now in 10 hospitals in our county, is that it becomes, we're all in this together. And what can we all do to fill the gaps and assist our moms to achieve their dream, which is breastfeeding their baby. Next slide. So when we do quality improvement around the issue of breastfeeding, what does it give us? Well, it gives us several things for the moms and babies right away. Improved attachment and bonding, nutrition, as I told you, I'm a dietitian, I get really excited about that one. Oh good, optimal nutrition. And patient satisfaction goes up. The story I'd like to tell you is about one of the hospitals that is within the Kaiser system, Kaiser Downey. Has the highest breastfeeding rates of all the Kaisers in Southern California. There's 13 medical centers. When they achieved baby friendly, it was May of 2010. During the first quarter, last quarter of 2009, the first quarter of 2010, and the second quarter of 2010, the maternity care department at Kaiser Downey received an award for having the highest patient satisfaction rates for the whole Kaiser Southern California system, 3 quarters in a row. So working on that last push to implement baby-friendly fully can be associated with high patient satisfaction. They can go hand in hand. I got to tell you, it can go bad also if the staff don't truly understand what we're doing here and everybody just beats people up about you must breastfeed, you must breastfeed. No, patient satisfaction will go down. We are here to support you in your goals to breastfeed. Then patient satisfaction goes up. So it's about the messaging. For the hospital, what are some of the benefits? Well, there is a new joint, well, it's not all that new any longer. It's been out a couple of years. The Joint Commission Perinatal Care Core Measure set is currently optional. It won't be optional forever. In the next 3 to 5 years, it will be required. So when hospitals jump on this now, they're prepared for when it is required. It is continuous quality improvement, which is what we should all be doing in our work anyway. One of the things that's really cool is that the staff competence goes up and self-efficacy goes up. So nurses feel, as you said, satisfied when they've helped moms and babies bond. And that's demonstrated in the breastfeeding, but so much more as well. It can be a marketing tool for the hospital as well. The Providence Holy Cross has a big banner on the side of their hospital's construction site, because they're building a new blah, 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 new wing. And it says, the first baby-friendly hospital in the San Fernando Valley. Well, they're not the only one anymore, but they can still say they were the first, because they were 5 years ago. I already mentioned increased teamwork. And then when we help our patients about breastfeeding, we as an employer need to look to how are we helping our employees. So worksite lactation accommodation becomes, it's not part of baby-friendly, it's not required, but it becomes an aspect of the work that you do within your hospital. And it's a matter of walking the walk as well talking the talk. And when employees are supported in their own breastfeeding, it's so much easier for them to then in turn talk to their patients about how this is a benefit for families. And it reduces absenteeism, because when babies are healthier, moms don't have to take so much time off from work, moms and dads. Next slide. For every benefit slide, I told you I'm a business person, there has to be a cost side. And there are costs associated with becoming baby-friendly. We do have to do staff education. We have to collect data if we're doing a quality improvement project. We may need to make facilities improvements. Sometimes the way our facilities were designed to separate mothers and babies at birth and then reunite them at some place or time in the future means we have to create a new way to keep them together. If we're keeping them together, that means that physical exams need to happen in the mother's room. Maybe the lights aren't good enough. Maybe there isn't enough otoscopes and stethoscopes and such. So there may be some facilities issues that need to be dealt with. And those have to be budgeted for and planned in advance. Also, when a hospital becomes baby-friendly, they may not accept free formula, bottles, and nipples any longer. So they need to purchase those items, and that is a cost. However, a study was done in Texas that the hospitals that were baby-friendly over a 5-year period had no significant cost per birth. So cost neutral over 5 years. Good to know. Next slide. So let's tie this to maternity care. My